Hi, my name is Christian Schoenhef, and today I will be talking about joints and types of movement. There are six major joints: hinge, pivot, ball and socket, ellipsoid, and plane. Ball and socket is one of the most interesting as it moves along many axes and planes. As you can see in this example, the top image shows circumduction and the bottom image shows abduction and adduction. Abduction is movement away from a midline and adduction is movement towards a midline. Circumduction is seen as a combination of the two as it allows for circular motion in many axes and planes. Ball and socket joints also allow for rotation towards and away from the midline. Medial rotation is towards midline, lateral away. This shows the shoulder moving toward and away from the midline. Hinge joints perform flexion and extension. That's because they can only move in one axis. The flexion is the decrease in the angle and extension is an increase. The knee and the elbow are the best examples of a hinge joint. Supination and pronation are the movement of pivot joints, and supination and pronation specifically discuss the movement of the ulna and radius as they rotate around each other to either put the palm up or down. Dorsiflexion and plantar flexion, similar to flexion and extension, are performed on a hinge joint. However, the ankle is special because it is used for diagnostic purposes. So dorsiflexion and plantar flexion are their own separate category. The same can be said about inversion and eversion of the plantar surface. Inversion and eversion are similar to abduction and adduction. However, it is tracked by the location of the plantar surface and used in diagnostics. Protraction and retraction are movement away from and towards anatomical position. In this specific example, the neck is protracted as the jaw juts out and retracted as the jaw juts back in. You can also do a form of overextension if you have the neck way too far forward or way too far back. Elevation and depression are also movements that can be performed as you move something higher than it regularly is or lower than it regularly is in anatomical position. This is performed on the joint between the scapula and the clavicle. And these are all of my sources. Thank you for listening.